welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today, we welcome back to the show Tomi Mitchell. She's a family physician in Canada, and she wrote the Kevin MD article, The Unique Agony of Being a Black Female Doctor. Tomi, welcome back to the show.
Thank you, Kevin.
So we'll get into your article in a little bit, but for those who didn't get a chance to listen to our first episode, can you just briefly share your story and journey to where you are today?
So I'm a board-certified family physician currently practicing in Canada. I am also a mental health and wellness coach and an advocate for social justice, and that was born out of my own personal experiences in the healthcare system as a worker provider and also as a patient receiving care in the healthcare system. So my desire is to share both sides of the story and advocate towards change and improvement.
So tell me about your activism in social justice and how does that influence you as a physician?
Well, definitely I am many minorities in one. So I'm a female Black physician and who has experienced the inequalities that we all know that they're there from early age and more recently as an adult. And it's definitely a vulnerable position when you are desiring care. And no, I only go if it's absolutely necessary. I don't go just because like I have a cold or something. These have been life-changing situations. And just seeing how healthcare delivery can vary from one place to another, from provider to a provider, all of which took the same oaths I took, it leads me a lot of questions. And also when I see those who don't even have a quarter of my experience, knowledge as a physician, how are they gonna advocate for themselves if they don't know that what they're going through might actually be catastrophic for them? I've chosen to be a voice for those who feel voiceless.
So give us a story or example of how your activism gives a voice to the voiceless.
Even though I might be female and Black, but I also have a privileged position as being a physician and being blessed to have the training, unique training I have. So that gives me a place of, in some ways, immediate respect and some degree of authenticity. There are apparently three professions that people trust the most. Number one, being a firefighter. Number two, being a nurse. And number three, being a physician. So we do have a very important role in healthcare delivery. And we make a huge impact, whether physicians, nurses, PT, OT, whoever it is in healthcare, over the lives of the patient and their families.
All right, so let's transition into the Kevin MD article that you wrote. It's titled, The Unique Agony of Being a Black Female Doctor. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
I wrote it because I was at a place of pain and frustration where I was, for lack of better words, I was tired of being muzzled. I wrote it as 2020 was a traumatic year where I had near-death experiences for myself and my daughter on multiple occasions. And I truly experienced my I can't breathe experience for her, where my 3-day-old stopped breathing. I had to do CPR on my child. That is, I thank God I had the skills and I was able to revive her. I took her to the hospital. She was admitted to the peds ward and I watched her like any other mother would do. And I saw her stats desat from 99 to as low as 51% on 6 separate occasions while in the hospital. Imagine post C-section 4 days. I went to ask the nurses. I told my child isn't breathing, she's seizing. They told me she's fine, it's just reflux. And they even changed the monitor. I said, my child is not breathing. Oh, it's fine, it's just reflux. And they knew I was a physician too, and they know I'm a mother because when I was admitted with my daughter, they said, oh, you're Dr. Mitchell. And my heart sank and I said, yes. That is one of probably a dozen experiences I've had. And it's sad that one has to truly beg. And in my case, I was able to call a female physician who so happened to be Black and told her what was happening. And she's like, oh my goodness, is the doctor on call? No, because the shift change happens around 8. And I said, no, because they haven't called anybody and I've asked. And then she called the attending And then pretty much after 12 hours of this agony, my daughter was finally admitted to the ICU. And at that point, I was able and comfortable to leave my child unattended. I went to the bathroom to relieve myself, and I ended up hemorrhaging. So I had a massive PPH and became a patient. And that repeated multiple more times over the next 2 weeks as my child was admitted from one unit to another, one city to another, because of her health. So the point is, as providers, we need to listen to our patients. It shouldn't take 6 times for you to call for help. And even for physicians in my care, when I would say, okay, I had a postpartum hemorrhage in my first pregnancy and I had 5 after the second, and that was delayed because it was 4 days after I delivered. And I remember asking for certain medications, which I knew that had saved my life before. And they're saying, oh no, we're gonna wait. I'm like, please. And they're like, why are you crying? And I'm like, because I don't want to die. Like, or at this point I was hemorrhaging so much, I had clots the size of my hand coming out and a stick under my hand coming out of me, shaking. And I remember the nurse saying to the other nurse when they came back, don't even bother putting a pad in her, she just soaks them through. I felt worse than a dog because I know we treat our dogs better. Now, I'm not painting the brush and saying all healthcare systems are like this, all hospitals are like this, but it's a reoccurring theme that we as women of color experience, and it's well documented. And it doesn't matter your education status, socioeconomic status, it's there. And it's a problem.
Now, after you went through these traumatic experiences, did you get an explanation from the hospital or medical staff as to why they didn't listen to you?
I got zero. I got zero apology, zero acknowledgement. And so, again, it's traumatic. I am sorry goes a long way. Now, if repeating the same thing and saying I'm sorry every time just means this lip service. But I mean, I've decided to take another route, and I'm being more vocal about this because I see my daughter who basically didn't have oxygen supply to her brain. I see the struggles that she potentially is going through, and that I can't just stay silent. And then not to mention May 25th, I think it was last year, with George Floyd begging for his life. I can't breathe. I'm begging for his mama. When I first saw that, I was numb. And then the anger and then the pain came and the tears. It took a month before the tears came because I saw in him what was my life with my second daughter just 6 months prior, begging that she can't breathe. Like, look at the monitor. I'm being told her lips aren't blue. She's okay. Like, it was just so many levels of just wrong. And is there an issue with the education system where people aren't, I don't know, told the differences between different races and colors and what to look out and vital signs? And or is it sheer ignorance? And personally, I am more of it is sheer ignorance and bias because I've seen it, not just in my life, but also in those who are less fortunate, who actually didn't survive, who've died. And it's my duty to say something, to speak, to train, to educate.
What are some things the healthcare system can do and those on staff that you may have encountered? What are some things that they could do differently to prevent future occurrences of this?
I recognize that there's implicit bias, there's biases. Okay, one of the biases is that Black people don't feel pain the same way. Well, again, one story I had, my first baby, I had a C-section. I got the pleasure of feeling my C-section, screaming in agony for them to stop, and they continued. We feel pain. And when you do harm to somebody, it's not just them you harm, it's their family, potentially. Second is to listen to them. Listen. Patients typically give us the answer of what's going on. That's why we take a history. And for me, I'm very forthright. I'll be like, A plus B plus C equals C. Like whatever, like I'll just tell you. You don't have to dig around. I'll tell you all the key things you need to know with the numbers, the stats. Like I'm a Rolodex. I'm a physician, I know what I'm doing. And I'll say it with kindness and respect. So don't see it as an ego trip. Don't be like, oh, how dare she tell us what to do? No, humble yourself and listen. Don't be so proud and arrogant and treat people like they're humans.
Now, is the answer more training? Is there anywhere online or courses that healthcare staff members can educate themselves?
Definitely starts in training with empathy and recognizing in our curriculums from early age, elementary school, that there is bias. Don't quote unquote whitewash the education. It's there. It's in institutions. It's in healthcare. It's fact. People have spent millions of dollars proving this fact. And many of us of color have experienced it. And it's not just coincidence if it happens repeatedly to us in certain places. If you don't know how to deal with it, because many people have put their head in the sand because they didn't have the tools to deal with it, find somebody to train and to teach on inclusion. Make sure when you're teaching your systems in medical schools and residency that you are taking in consideration cultural differences and color differences. But by the time I show signs of anemia, I might as well be writing my obit or my will. And I literally did write my will in the hospital. I'm not going to be white. I'll be pale, like mucous membranes, and mine were like my version of white. How much more someone who is like the darkest of dark, black almost blue, I like to call, because we have different spectrum. You gotta pay attention. And knowing what is normal for one is not necessarily normal for others. If your patient tells you, my blood pressure is normally 85 over 65, which is mine. Like I have a very low blood pressure, low resting heart rate because I believe I'm in shape. So when my blood pressure goes to 130, 135, 140, and you think that's okay, no, that's not okay. That's my body saying, hello. So listen to the patient when they tell you. Listen. Don't prejudge. And think as the patient as being your mother, your sister, your wife, your brother. And that's how I treat my patients. They're my cubs. So I do my best to help them. And something I do not know, I find help for them.
We're talking to Tomi Mitchell. She's a family physician in Canada. She wrote the Kevin MD article, The Unique Agony of Being a Black Female Doctor. Tomi, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Well, thank you for listening. Change needs to happen. As women, take away the Black, we definitely have a challenging road ahead of us in medicine. We're often, aren't the quote unquote leaders and don't get certain positions for many different reasons. I'm not going to go into them, but just know we all have our biases. We all do. And I do. But let's keep them in check. Let's really think when you see somebody, what comes first to your mind? Do you think them as being drug seeking? Oh, they can wait. And when you think of someone who you need to act on right now, who do you think of? Is there a difference in care? Now, this is pre-COVID, obviously. Is there a difference in how you respond to them? Can you honestly say that's how you would want to be treated? You need to ask yourself that, the golden rule, do unto others as you have them do unto you. And studies show Black patients who are treated by Black physicians of color have better outcomes. It's a fact. So that representation really matters, not just color, but culturally. Having lived across this globe in different continents, there's a difference in how people express themselves and how they expect care to be delivered in a very sensitive, culturally competent way. That needs to be taught. So thank you for listening. Take the time, make it a priority to learn to check your biases because we all have them. But that should not come in the way of us giving, caring, empathetic care where you, as if you were that patient, you would be happy, proud of the care you've received. And I must say, I have received excellent care. There are places I know where to go to now where I can receive excellent care. So I'm not saying painting everyone the same brush, but I'm saying listen to your patients. Like, just listen and act.
Tomi, thank you so much for sharing your time, insight, and story. And thanks again for being on the show.
My pleasure.